Hello everyone, welcome to another session of Next Saviours Essential Question Series for NEET PG 2025. Today we are going to have a discussion on the management of the contaminated wounds and what are the creams, the solutions and the VAC dressing which is utilized for the purposes. Before we can make the wound contaminated, if at all, if it is in the hand of the surgeon, then these are the two important solutions which are needed to be recognized. One is the povidone solution containing 7.5% concentration, and the another one is the solution that contains 5 to 10% of the solution. And what is the difference in between the two? As you can very clearly see, one is required for the scrub purposes and the other one is required for the application purposes. So what is the difference in between the iodine scrub versus the iodine solution? As you know that the iodine scrub, it contains povidone iodine plus detergent, and this detergent is responsible for foamy or lathering when it is applied. It is also responsible for making its appearance thicker and gel-like, and its action is basically for the remove, and it is utilized basically for the removal of the dirt, oil and microbes. On the other hand, the iodine solution, it contains povidone iodine in aqueous or alcohol based solution. So obviously it is non-foamy, it is liquid form, it is thin, it is water-like, and it primarily disinfects. So it has no cleansing property as far as uses are concerned. So the scrub is used for pre-operative surgical hand scrub and for cleaning the wound as well as for cleaning the part over which the surgery has to be performed. And the other one is for iodine solution, it is used for pre-operative skin preparation, wound antisepsis and catheter site disinfection. Now, is the rinsing required in case of scrub? Obviously, yes. So it must be rinsed off with sterile water after scrubbing, while there is no scrubbing, because whatever the paint that you have applied, it is allowed to dry for optimal antiseptic action. What is the preferred concentration? 7.5% of the povidone iodine scrub, while 10% for the povidone iodine solution. Although the concentration, it depends upon the surgeries, like in case of orthopedic or where the possibility of contamination is high or the complications related to infections are high. In those surgical procedures, 10% povidone iodine solution is used, while where the possibility of contamination is low, like ophthalmological surgeries, the facial surgeries, so there 5% could be utilized. Now, pre-operative use first. Now, it is used to scrub the hands as well as the skin over which the surgery has to be performed. And second, the iodine solution is applied after scrubbing. It is left to dry before the draping is done. So, effectivity, it cleans plus disinfect, while the solution, it is responsible for disinfection only. So, it has got stronger antimicrobial action, and it is best for hand washing before surgery as well as cleaning the dirty wounds, while the iodine solution is responsible for a skin antisepsis before surgery as well as for the wound irrigation. So these are the basic two differences. It is very much possible that these two images could be provided to you in the question, and then they can ask you what is the indication which is used in the general practice. Now, although wound can be classified based on etiology, it could be classified into incised wound, the laceration, the abrasion, the puncture wound, the avulsion, the crush injury or the gunshot wound, but we are not here to discuss the etiology of the wound. We are also not here to discuss the classification of the wound based on the depth, like superficial, the partial thickness wound or the full thickness wound. What we are here to discuss is the classification which is based on the contamination. Like one is the clean wound, which is where there is no contamination, it is a aseptic condition, and the prime example is the normal surgical incisions. The other one is the clean contaminated wound, where the surgical wound involving the gastrointestinal, respiratory or genitourinary tract without any infection. So, for example, the elective bowel surgery was performed, so it is considered to be a clean contaminated wound. On the other hand, the contaminated wounds are where there is a presence of microorganisms with the potential for the infection, like a traumatic wound, the open fractures, and the fourth one is the infected wound, where the active infection along with the abscess or the cellulitis is present. So what we are going to talk about is the management of these contaminated wounds, if not the infected ones. What are the basic ointments? What are the creams, the solutions which are required? We'll be talking about it one by one. Means these are the options which are available. And the most commonly used in the practice is povidone iodine ointment. The basic composition is that it is made up of povidone iodine, which could be 5 to 10%. And the iodophore complex, which is responsible for slowly releasing the free iodine, that is a water soluble ointment base. Now, the mechanism of action is that it releases free iodine, which penetrates the microbial cell wall and disrupts essential enzymes, proteins, and DNA, leading to bacterial death. So, this is a bactericidal cream, and it acts against a broad spectrum, or it is having a broad spectrum bactericidal action against gram positive, gram negative fungi, viruses, and protozoa. And most importantly, it is responsible for preventing a biofilm formation in chronic wound. So this is how it can be identified. These are the mechanisms, and these are used in the management of the contaminated wound. Another example is the silver preparations like silver sulfadiazine. The mechanism, you know that it releases the silver ions that interacts with the bacterial DNA and proteins, thereby inhibiting the replication. And it acts against gram positive, gram negative, and the fungi. So it is having a broad spectrum action. Indications are simple like burn wounds or the ulcer, and the contraindications are G6PD deficiency because of risk of hemolysis, and it has to be avoided in pregnancy as well as in case of neonates. Now, these kind of the formulations are used with other bactericidal agents for its agonistic actions. So another is non-crystalline silver, which provides a sustained silver ion release, increasing the bactericidal effects. And the indication is again same, that is chronic wounds, which could be diabetic ulcer, pressure ulcer, or infected sulfur wounds. These are the other options. The third one comes in the category is hydrogen peroxide. You know how it releases the nascent oxygen radicals, thereby disrupting the bacterial cell wall. So it is bactericidal again. And what are the indications? Superficial or the minor cuts and abrasions. What are the particular contraindications? It is not for the deep wound because of the risk of tissue necrosis, and it delays the fibroblastic activity. So hydrogen peroxide is also used particularly in orthopedic practice where the wound has to be managed, the superficial wound has to be managed or decontaminated. Another one is the mupirocin ointment. So it inhibits the bacterial isoleucine tRNA synthetase, preventing the protein synthesis. The spectrum, it is effective against methicillin-resistant Staphylococcus aureus, because Staphylococcus aureus is the most common organism which is responsible for causing infections in these wounds. That is the reason why mupirocin is a very commonly used cream or the ointment in general practice, and it is also effective against the streptococcus. So what are the indications? Impetigo, infected wound. The contraindications, as you know, that prolonged use can result in the development of the resistance. Another one is the presence of the collagenase. Now collagenase has got an advantage that it is responsible for breaking down the necrotic tissue. That's it. So majority of the time, because of its agonistic action with another bactericidal agents, it could be used in combination. So the indications is chronic non-healing wound or the pressure ulcers. Now the contraindications, because it is not a bactericidal itself, so it is very commonly used adjunctively. But this is the only mechanism that you have to remember, that it is responsible for breaking down the tissue necrosis. Now, superoxidized solutions. You know, superoxidized solutions are novel wound care solutions which are used for infection control, wound irrigation, and biofilm disruption. These solutions have gained importance due to their broad spectrum antimicrobial activity, biocompatibility, and safe in the deep wounds. Now, superoxidized solutions are electrochemically processed solutions which consist of hypochlorous acid, the sodium hypochlorite, hydroxyl radicals, and in some of the cases, even ozone in some of the formulations. The mechanism of action is that it is responsible for direct microbial killing. You know, hypochlorous acid disrupts the bacterial DNA, protein, and lipids. It is effective against gram positive, gram negative bacteria, the fungi, and the viruses. Another important mechanism is the biofilm disruption. You are aware of the fact that hydroxyl radicals, it penetrates the biofilm, enhancing the effectiveness against chronic wound infections. And the third one is the tissue biocompatibility. So unlike hydrogen peroxide, superoxidized solutions are non-cytotoxic to the fibroblast and keratinocytes, thereby promoting wound healing. So this is the advantage of superoxidized solutions over the hydrogen peroxide, and these are available in the spray formulations. And finally, the kind of the question which they are asking very frequently now is the negative pressure wound therapy or the vacuum assisted closure in chronic wound management. You know, the vacuum assisted closure, also known as negative pressure wound therapy, is an advanced wound care technique that promotes faster healing, reduces the infection, and enhances tissue regeneration by applying controlled negative pressure. That means suction to the wound. What is the mechanism? A vacuum, that is negative pressure, is applied to the wound through a sealed dressing which is connected to the vacuum pump. Now, this results in increased the blood flow, thereby enhancing the angiogenesis, removal of the excessive exudates and the bacteria, mechanical contraction of the wound edges, and decrease tissue edema. So what are the components of the VAC therapy over which they have asked these questions multiple of the times are the vacuum pump, which is responsible for generating the negative pressure, typically in between 75 and minus 125 millimeters of Hg. There is going to be a pump which is attached to this pipe. Then there is a foam dressing which distributes negative pressure evenly. Then there is a occlusive film, which is adhesive tape over here. And this adhesive tape is responsible for sealing the wound to maintain the negative pressure. And finally, there is a canister and the tubing system, which is responsible for collecting the exudate and preventing the reinfection. So these are the components of the VAC therapy. What are the indications? Chronic wound, obviously, like diabetic foot, venous stasis, pressure ulcers, non-healing surgical wounds, the acute wounds like traumatic wounds, the post-surgical wounds, the burn wounds, or the special indications are open abdominal wounds or orthopedic wound, particularly after the amputations or in case of open fracture. So hope you have understood the session. All the best for your future examination. We hope that these kind of the questions are likely to be asked in your examinations. In order not to miss any update, please join our Telegram group. The link is provided in the description. All the best. Thank you.